volume guarantee has been shown in research, of course, to show a reduced BPD. Yeah. But remember that if you are sensible enough, if you're using the other synchronized modes like SIMV or SIPPV or PSV as we call it, PTV, I mean, any mode assist control, different names for the same modes. But ultimately, if you know what you're doing, as long as you don't overdo the ventilation, the effect will be similar. And all the more reason for that is we are giving only short-term ventilation these days. I mean, we try to extubate the babies within a few hours. So if you are not overdoing the ventilation, especially watching the complaints after the surfactant and weaning the pressures, it would work equally well. The reason volume guarantee shows the benefit is because in most units, the junior, most people are the ones on the ground. They don't really understand the exact mechanics, and they allow the baby to get to excessive volumes after the surfactant is given. If you're keeping the same pressure, the complaints changes after the surfactant and there is over distension. And that's where you damage the lung. So if a competent person is watching, a senior or experienced person is watching, and they know exactly what's happening, the effect will be similar. But in a larger group and in a bigger unit, for example, this is the only way it will work. The junior people will be the ones on the ground. And so volume guarantee makes it easier by regulating it. I mean, the pressure adjustment is done by the ventilator because the volume delivered will obviously be at a lower pressure when the lung complaints is